Namaskar. Today we'll talk about hypertension, high blood pressure, and its homeopathic treatment and approach. Well, hypertension is a very common condition. As most people know by now that we have two pressures, diastolic pressure and systolic pressure. Systolic pressure range is around 120 to 140, while the diastolic range is supposed to be less than 90, from something like 70 to 90. And when the blood pressure increases, and when your blood pressure is recorded high, at least on three occasions, higher than 140, the systolic one, and higher than 90, the diastolic one, especially in the middle age and above, then this may require medical attention and you may have to take some medicine. If you have only one high blood pressure recorded, then you are probably not a good case to get started with the conventional anti-hypertensive medicine. This has to be kept in mind because blood pressure keeps fluctuating, as everybody knows, and one occasional high reading or high reading could be because of human error, because of the machine error, or maybe because of just a normal physiological variation. So that may not require a lifelong medication, which requires observation. Lots of patients, they start with conventional allopathic medicines for high blood pressure, the typical anti-hypertensive medicines, as soon as they are diagnosed with high blood pressure on three or more occasions. In this video, we'll talk about what homeopathy has to offer for the cases of high blood pressure or hypertension. In our experience, we would say homeopathy has some definite role to play. At the same time, I would like to say that not that every case of high blood pressure will get resolved only with homeopathy, because high blood pressure is an index which is a matrix which may have severe complications sometimes because it indicates the cardiac health. And if the blood pressure remains high or if it tends to become extremely high on some occasions, then it can have its own adverse effects and repercussions. So when you treat hypertension using homeopathy, your homeopathic doctor has to be fully aware about the medical aspects of high blood pressure and its pathology. All in all, homeopathy experience says that early cases of high blood pressure could be treated with homeopathy, requiring at the same time good monitoring. On number of occasions, we have observed that homeopathically given medicines can alleviate, reduce high blood pressure, and patients may get well completely without requiring conventional anti-hypertensive medicines. This is already proven not only by us but by number of physicians who treat hypertension using homeopathy. There is another category of patients who may have been on anti-hypertensive medicines but for less than 2 years in our experience, and their pressure may be under control or not under control. In both these categories, homeopathy still is an option. Homeopathy still is a choice whereby we can try to see that slowly the blood pressure becomes normal and it remains normal, and in that case it is possible to reduce the conventional anti-hypertensive medicines slowly, steadily, and with close monitoring. Because when you reduce the conventional allopathic medicines for hypertension, for initial few days, for a week or 10 days or 12 days, there may not be any symptoms, there may not be any increase in high blood pressure. But after 12-13 days, one might find that the blood pressure shoots up and it may have its own after effects. So it's very important that one has to closely monitor the readings, on different times, morning and evening, for several days after giving the homeopathic medicines. We have seen that many of these patients we could reduce and even stop conventional anti-hypertensive medicines successfully when we put them on homeopathy. There is another category of patients who may have been having high blood pressure for a long time, more than 2 years, and they are on medications for more than 2 years rather. And this category, we have seen that it is very difficult to reduce the anti-hypertensive medicines. And I would say these are the patients who should rather continue the conventional treatment because it may not be safe for all of these cases to switch over to homeopathy. Some cases there may be exception, but otherwise in general it is recommended that you should rather continue with the conventional treatment. So I have a very moderate and conservative viewpoint on treating hypertensive patients using homeopathy. Of course, regardless whether you are treating the patients with homeopathy or conventional medicine, when you are treating hypertension, one should not depend solely on the medicines. One has to make sure that the lifestyle changes are taken care of. The patient should not live sedentary life. We have to add exercise, fitness, regime, etc. in one's life. And also more important is that you bring about drastic changes in the food habits, because food has a lot to do with your body, your health and your cardiac health. So dietary changes are extremely important. Also, it's important that if patient is having any additional concomitant complaints like diabetes mellitus or anything else, that also needs to be managed very well if you want to have successful treatment for hypertension. So all in all, a very comprehensive understanding of the patient's health and lifestyle required in order to treat hypertension using homeopathy or any other system of medicine. I believe these insights will help patients who are seeking help using homeopathy for the treatment of hypertension or high blood pressure. Thank you for watching.